I'm your host, Jenna Cleofe, here with a special segment on fascia. You may or may not know what fascia is. Fascia was originally discovered by Dr. Andrew Taylor Still. Our awareness of fascia and our understanding of its key role in the body has expanded rapidly over the last century. Fascia is basically a band of connective tissue that surrounds every muscle, bone, organ, nerve, artery, and vein in the body, right beneath your skin. It is tough and densely woven, and fascia is a single uninterrupted web that encases, connects, and interlaces everything in the entire body. Fascia is relaxed and free to stretch and move without restriction in its normal, healthy state. It absorbs and distributes tensile forces and acts as a communication network for mechanical, energetic, chemical, and informational exchange. When stressed, it tightens up, causing restrictions, which is why we've interviewed some specialists to help educate you on your fascia and its health. Now we'll let Sean take over with the interview.
Good morning. This is Sean from Vacc News. Today, we have a guest who is the best health practitioner in the world. Hi, would you please introduce yourself?
Hello, Sean. I'm Haley. I'm a physiotherapist.
I heard you are a very famous physiotherapist treating myofascial pain syndrome. Is that correct?
Yes, I have treated so many patients with MPS in the past years.
Okay. So what is myofascial pain syndrome exactly? Can you tell me more about it?
Myofascial pain syndrome is actually just a fancy way to describe muscle pain. It refers to pain and inflammation in the body's soft tissues. MPS is a chronic condition that affects the fascia.
Wow, that's interesting. So Haley, what kinds of treatment do you do?
As a physiotherapist, we use ultrasound, dry needling, and manual treatment.
Then what is dry needling?
Dry needling, also known as myofascial trigger point dry needling, is an alternative medicine technique similar to acupuncture. Dry needling is mainly used to treat myofascial trigger points, but it is also used to target connective tissue, neural alignment, and muscular alignment. Deep dry needling will inactivate myofascial trigger points by provoking a local twitch response, which is an involuntary spinal cord reflex in which the muscle fibers in the top band of muscle contract. The relief of myofascial trigger points has been more highly researched than relief of connective tissues, muscle fascia, muscle tensions, and scar tissue. Dry needling of multifidi, the paraspinals, the psoas, and the quadratus lumborum can be quite effective.
Okay. What about ultrasound? How does that work?
Ultrasound therapies can be divided into high and low power therapy. Low power therapy can evoke short-term segmental antinoceptive effects on the trigger points, thereby having an effect in the overall pain reduction. High-power ultrasound was considered to be one of the cost-effective, non-invasive alternative treatment methods for myofascial pain syndrome. A study in 2004 suggested high-power pain threshold ultrasound technique was more effective than low-power normal ultrasound for myofascial release.
Okay. In terms of manual therapy, what kinds of manual therapy do you do?
Well, I apply heat to soothe constricted muscles to use ice to calm swollen areas. I also demonstrate self-stretching exercises to maintain flexibility and increase range of motion, and aerobic exercises to increase blood flow to the affected area. We encourage the patients to practice these exercises at home daily as well. Myofascial therapy can also enhance or assist other treatments to increase their effectiveness, such as acupuncture, manipulation, physical therapy, or occupational therapy. Myofascial release therapy can also improve skeletal and muscular alignment prior to a surgery, or help athletes achieve better alignment prior to sports competitions. By targeting specific areas of the fascial system, myofascial therapy can help prepare patients for more aggressive forms of strengthening or provide pain relief for patients with restricted flexibility and movement, thus allowing patients to return to normal movement and greater function.
Okay, wow, I think I need to book a treatment from you soon. Thank you for being here, Haley. Next, Justin is meeting another health practitioner now. Hey Justin, are you there?
It seems like Justin is having some technical difficulties, so we'll just switch to commercial break. We'll be right back.
The all-new foam roller, brought to you by VCC. Foam roller! By now you've likely heard about some of the benefits of foam rolling. Foam rolling is a great way to check in with your body to pinpoint where exactly your fascia is tight and holding tension. Just go onto the roller and let your muscles talk to you. While foam rolling, when you hit a trigger point or tight spot, sit and work on that spot for 30 to 6 seconds as it slowly dissipates. Over time, this will help restore the fascia to optimal health. Foam roller! Foam roller!
Imagine doing yoga classes here. Peaceful. Serene. Quiet environment. You can feel as peaceful and as calm as these people. Imagine doing yoga here. But you won't be. But you can still try out our yoga classes. Yoga, taught by real people at VCC. Hydrate and free the superficial layers of the fascia. If that isn't enough to convince you, just check out how exciting the classes are. Look at how majestic the students are. Enroll now.
Dehydrated fascia doesn't glide as well, so make sure hydrate.
That's right! Dehydrated fascia doesn't glide as well, and the increased friction signals the release of inflammatory chemicals, which lay down a gluey material, hence fascial adhesions, that feel kind of crunchy. If we get dried out, we are more brittle and are at much greater risk for erosion, a tear, or a rupture. One way to keep the fascia hydrated is obvious: drink lots of fluids, which is why we've been in this lab and we came up with an all-new gluten-free, sugar-free, lactose-free, caffeine-free H2O beverage that everyone can enjoy. Made of 50% water and 50% H2O. We noticed you guys loved our last blend of 75% water and 25% H2O, so we sat down with a group of fascia specialists and decided to add 25% more H2O, so you can keep that fascia hydrated. Say goodbye to that dry fascia.
Nice. Whew. Refreshing. I can do this all day.
Say goodbye to dehydration and dry fascia.
I can do this all day.
The newest home workout video. Fascia training with world-famous fascia fitness expert Sean. Watch as he takes you through exercises to help strengthen you and your fascia. Multi-directional exercises using light weights such as lunges, kettlebell swings, windmills, foam rolling, Pilates, or yoga. All of these were developed by Sean himself in order to train your fascia. Fascia training involves applying force during the lengthening or relaxing phase of muscle movement. Sean will also take you through some stretches for your fascia. Order a DVD now and we'll throw in a Swimming with Sean home swimming lessons video. Order now. Call 1-800-555-6355435.
And we're back from commercial break, here with Justin with a new report.
Hello, this is reporter Justin. Today I have Jordan, who is a professional RMT. He worked for more than 30 years as an RMT. So Jordan, hello, how are you?
Thanks for the introduction. I am excited to share this news with you.
We have a great question to start with you, Jordan. What is fascia? Can you please explain?
Fascia is a sheath of fibrous connective tissue found in our body that binds muscles together, organs, and other soft structures of the body. It is divided into superficial fascia and deep fascia. Superficial fascia is made of loose connective tissue containing collagen and elastic fibers. Deep fascia is made of organized fibrous connective tissues that cover muscles, nerves, blood vessels, bones, and their continuing structures, for example, tendons and ligaments.
Great, thank you for your answer, Jordan. So the next question is, what is the role of fascia?
Superficial fascia helps with the balance of temperature and providing cushioning and protection for organs and muscles. Deep fascia helps separate and connect all muscles and organs, bones and nerves together so they can work properly. It is filled with many nerves and sensory receptors such as nociceptors that detect pain, proprioceptors that detect movements of limbs, mechanoreceptors that detect pressure, and thermoreceptors that detect temperature. When our body is in constant stress, is damaged or inflamed, fascia shortens and thickens. This may cause nerves to be pinched, which causes pain. And since fascia covers muscles, the shortening of the fascia will cause a decrease in range of motion. If muscle injuries or muscle overuse occurs, a painful bunching of fascia may occur in muscles. We call these myofascial trigger points. When pressure is applied on these areas, referred pain may occur. This is pain that is felt elsewhere other than the origin of the pain.
Thank you for your answers, Jordan. But can you please explain more in details?
Some techniques we can use to relieve myofascial pain and trigger points are myofascial release techniques, trigger point release techniques, and the strain counterstrain technique. Myofascial techniques involve deep and direct pressure and the stretching of myofascial structures. This can help with decreasing pain, increasing muscle tissue pliability, and increasing the range of motion due to the breaking down of the fascia. The trigger point release technique involves putting direct pressure on a myofascial trigger point. Holding the pressure on the trigger point for 5 to 30 seconds will help release and soften the myofascial structures in that area. This is good for short or medium term pain relief. If the trigger point is held for too long, it could become even more sensitive. The strain counterstrain technique involves finding a trigger point, applying pressure on it, and moving the joint or body part away from the movement of restriction towards the direction of ease. If done correctly, the trigger point should no longer be painful.
Thank you for giving us great information about fascia techniques, Jordan. It was very helpful for our R&T students. And we appreciate for coming out today for this show. And I hope you enjoy your day. Bye.
And finally, here we got an exclusive inside look at a new yoga facility here at VCC, taught by instructor Haley. Let's go check it out.
Yoga is one example of an exercise or body practice that works on our fascial network. Psychological and physiological trauma is held by our fascia, and we need to approach our fascia with patience and care. Moving through yoga poses begins to hydrate and free the superficial layers of the fascia. Healthy fascia relies on both movement and hydration. Some yoga poses lengthen various myofascial lines. Yin yoga is a popular style of yoga in which gentle positions are held for several minutes with the use of props. It is ideal to hold postures for at least 60 to 90 seconds, or until heat is felt in the areas that are opening. Yoga is a good balance for engaging and lengthening the muscles. Some positions are great for lengthening certain myofascial lines. The extended side angle pose is good for the lateral line. The camel pose is good for lengthening the superficial front line. The downward facing dog is good for lengthening the superficial back line. The seated gate pose lengthens the superficial arm front line. The single leg revolved belly pose lengthens the spiral line. Strain, trauma, and injury are passed through the fascial lines. When these occur, the fascia hardens and blocks oxygen and nutrient flow to the injured site. In the long term, this may cause restrictions and misalignment in the body. The fascia needs to be pliable and hydrated for healthy movement.
Where are you going?
Home. Hold your balance.